theaters all through their lives, they have 5 times higher risk for stones. So, that's a part of it. Heat exposure, very easy to understand. One of the problem with the stones is the first one. The advancements that have happened in the removal of the stone once it is formed, same thing is not being looked at. How to prevent, how to see the stones are not formed. Because there is a lot of money in lasers, there is a lot of money in the industry, pharma. Everyone is targeting to get it removed. That's what the continuous presentations happen. But hardly any research available to prevent, revive, get back to the same health what we had decades back. How many of you agree that we all fall into this risk group? Or few risk groups, there are many. How many of you agree? The previous risk groups. How many of you agree that we all fall into these risk groups? Yes? How many of us regularly exercise? Can lift your hands? Right? Those who don't exercise, there is 10 times high risk for stones. What to talk about other things? They're all the package. Diabetes, obesity, everything is a package. They all come together. How many of us see the color of the urine regularly? We don't. Are we in the stone belt? How many of you know there is a stone belt like this? For some unknown reason, these are the states, these are the parts of our country which are stone belts. That means people have stones here. Prevalence of stone disease is highest in these places. There are like this in the world. So our Maharashtra is there. So definitely this is relevant for us. Why is it relevant for us? Very important thing. This metabolic syndrome has caught all of us. It's not 1, 2, 3 things. It's a package where there is a obesity, there is a lipid profile derangement, there is diabetes, there is hypertension, and there is stones. So those of us who have 2 of them, the rest 3 come as a free package. Those of us who have 2, rest 3 comes as a free package. What's the treatment? Lifestyle. Nothing more. That's the only treatment what is there. Okay, that's fine. Please see what is the statistics saying. What is wrong to have a hypertension in a part of these things? There is hypertension with stones. There is a significant risk for heart attacks, myocardial infarctions. There is a longitudinal study which has shown 31% high in them. Right? There is a cohort study done in Canada on 3 million people. It is not few places, no. There is significant rise in heart attacks. See that? What happens? As the stones, once a stone former is there, the risk for him having a myocardial infarction rises significantly. There are so many other risk factors too, but most important thing for us to remember, there is only one randomized study done which is recommended, proven, what prevents stone, which is that fluid. People have studied, those who have taken good amount of fluids, in the study they have used 1.5 liters. That's a Western study. For them it is 1.5, but for Indian studies it has to be 2.5. In them there is a lower risk for stone. That's only randomized study available in prevention of stone. There is so many studies you can open on the stones. You will find this laser is compared with something, that is being compared with this, that goes on and on and on and on. But there is not many studies on prevention, especially with the proof of randomization. Hardness of water, there is equivocal proof, but definitely it is a risk factor for the stones. Urine is a complex substance, complex liquid. How does one form stone? Very simple. How many of us have done the simple experiments of a beaker and water, and we continue to put salt in that? What happens to that? After some time, what happens after that? Saturation, and then no more dissolves. A simple concept. Same thing. For somebody to have a stone in the kidney, there has to be first something called supersaturation. What we should know, for a calcium oxalate stones, which are the commonest 90% stones in the humans, the supersaturation required for crystallization is 7 to 11 times. So what it means, as soon as there is so much saturation of calcium oxalate there, still urine, they don't form stones, they don't form crystals. What makes it? There are some substances called inhibitors. What are they? They inhibit crystallization of stones. That is naturally available with us. So they don't form stones till they come to 11 times the normal saturation levels. So a simple understanding of a formation product for the stone, for a solubility product for the substance to equalize coming to the saturation. Very important thing. Why we are trying to understand all this? Very, very important that I don't want to be a stone former. I want to learn, and if I want to give any medication, any therapy to anyone, it is not just going and removing the stone. That is one part of a plumbing work. Very simple. There is nowadays miniaturization things are there. What next? What next? Very, very important thing for us to understand. Unless and until we get this message right now, we will not be able to understand. We have to go down to the basics and try to help people, try to help ourselves. People come and ask, sir, there is pain, stone is stuck, creatinine is high. Sir, I got a big important meeting, I need to go to Delhi. Please do something, I go and come back. That's what the lifestyle today is going on. That's going on today. Doctors are no less. They can work hours and hours without taking care. We are the people who don't comply to any of the guidelines we give to the patients. Right? But this is very, very important for us. We don't want to have heart problems. We don't want to have kidney problems. Right? Very high risk of CKD is there. So I'll skip in the interest of time. I can share that later on. You can see that's a very beautiful video, about 6 minutes. That once you see that, it just gives a basic understanding of how stones form, so that we can self-work on prevention of that. There are 4 steps here written there. Very simple understanding. There has to be nucleation, there has to be crystal growth, then aggregation, and there has to be retention. What does it mean? Crystallization, nucleation, very simple. A substance supersaturated forms crystals. And sometimes it could be heterogeneous. A foreign body particle could be there, some tissue could be there, over that crystallization can happen. So, like infections, the infective stones, if you see that they are very nice laminated structures. Central black, white area, then black, white area. That is how they form stones there. Heterogeneous nucleation and homogeneous nucleations. Then crystal growth. If there are no inhibitors, crystals start growing. And there are no inhibitors which stop aggregation, they grow. So after that what happens? They need to stay in the kidneys, right? If they come into the ureter, then they will tell us. They will tell us. How many of you have had ureteric colic in your life? My internship, I had ureteric colic, and I used to tell them, please give me nothing less than 14 phenarchin. I still remember. It's so painful. Right? So retention is a very important part of the things. So going ahead, stone doesn't have only the crystalline component, but wherever there is a infection part, there is significant of matrix which is there. So some of the important things to remember in the, is the pointer seen somewhere? Is my pointer seen there? So, few things to remember. Magnesium citrate, very, very important aspect. Why this is? Because when we prescribe, these are the things we want to give. You can see potassium citrates being given, magnesium potassium citrates being given. We should know how they are working, where they are working. Right? Very important aspect. These are all the inhibitors for stone formation. Right? This we discussed already. Another important intraoperative, when we look inside the kidney, not from outside, inside through the ureteroscope, inside the calyx, at the tip of the papilla, you can see the all well magnified things. Pointer is not there. So you can see the calcium depositions inside, it is still not manifested. Further, if you go a little closer, this is how they are there. They are future stones. So when we see the stone formers, almost 100% people have this. How does it implicate to us? As urologist, I see inside, I see in every patient this is there. What does it mean? Anybody wants to say? What does it mean when we see this? I have removed the stone from outside, but I see this inside every calyx. What does it mean?
Beginning of stone.
Stone formation. Then he is going to be a regular customer for rest of their life. Every stone former is going to be a regular customer for a urologist. That's what it is telling us. Right? Every stone former. That is how things have become now. Right? So we need to work there. We need to work on these aspects. There are not much advancements happened in here. Right? Not happened here. So this is where our lifestyle, diet style, all those risk factors we need to change. Unless and until we work there, not easy. We can go remove the stones n number of times. We got miniaturized scopes. It goes on and on and on and on. But see this. Dear friends, I want you to see this. Take it in your hearts. This is there, and not only in the stone formers. If we look in people who are sitting here, 40% of us will have this picture in our kidneys. Right? 40%. I don't know how many of us sitting here. 40% of us will definitely have this picture there. Very dangerous scenario. We know 80 to 90% of stones are calcium based, calcium oxalate, calcium phosphate being the commonest, and the uric acid comes the next, which is there. So in the interest of time, we'll just push through various reasons for that, but still we need to understand why calcium based stones are forming. Definitely there has to be more calcium in the kidneys, in the urine, right? How is it coming there? There has to be more absorption. Simple to understand from the intestine. There could be some conditions where there is more absorption of calcium from the intestine, and then there is more urinary excretion there, right? So PTH, parathyroid hormone, plays significant role. Right? You may ask me, parathyroid hormone, hyperparathyroidism is another condition. All of you know that? Hyperparathyroidism? Where are parathyroid glands?
Behind the
Back of it?
thyroid gland.
Thyroid. How many are there? Four are there. Good. So it's very, very, very tiny pea-sized glands, and they play significant role in the calcium metabolism. Right? Hyperparathyroidism means there is hypersecretion of that, then there is a lot of calcium there. Right? So they form stones. But it is seen only one kidney forms stone. What did I say? Only one kidney forms stone. If the hyperparathyroidism is a primary reason for that alone, what about the other kidney? What about other kidney? People have said maybe he is sleeping that side all the time. He is sleeping on one side. No. People have done the studies also to see if somebody is sleeping on one side. There is a number of studies. Right? Is that the reason for the stones? So, to understand, it's a multifactor. Just because somebody has got hyperparathyroidism, it doesn't mean every kidney has stones. One kidney gets the stone. They have high risk. But why we need to know that? Treating hyperparathyroidism prevents that high risk part. At least that risk part which is there. So, another part is a hyperuricosuriia, a lot of uric acid. There's another disease, all of you know that, gout which is there, right? So hypocitraturia, very, very important thing. How does this affect? Because citrate is another liquid which is given very, very freely to people in the stones. Yes, it does help, but we need to give lots of it. Why? What happens if you give lots of it? They feel bloating all the time. That's one of the problem with it. But it's a very good thing. It works at various levels. It is significant inhibitor for crystallization, aggregation, and crystal detachment from the cells also. Very, very important thing. So what I will do, in the interest of time, I will not go through the slides now. There are a number of slides. I don't know, the next speaker also will be coming. so I'll just briefly explain, and then after that I may take some questions for you. Right? Now that we have basically understood how the stones are formed, there has to be some supersaturation and various metabolic disturbances which would lead crystallization of the stone. And once crystallization happens, then what happens? Crystal has to grow. And just growth means just growing? No. It has to get an aggregation. And then every crystals which are aggregated, they continue to form stones? No. They get fleshed out. But if they get retained, they grow, which are there. Right? This is a basic mechanism for stone. Right? So infection stones are very, very important. This is not seen in the Western world, but in our India, infection is a major morbidity for stones or any procedures also. Right? If you study any of the procedures, whether it's a lower tract urinary procedures or kidney procedures, the sepsis infection comes on the top. So infection part forms a nidus. So what is a nidus? Heterogeneous crystal. Over that there is a cementing. You can just simply say cementing that happens there. Right? So kidney stones are very common. And what is the presentations? What is the commonest presentations nowadays? Anybody wants to say? Commonest presentation, I said health checkups. Every third sonography has.
Pain.
Pain is less common now. So people will come. Every day at least 2 messages will be there in WhatsApp. So and so sonography shown something. Somebody known to somebody, this thing will definitely will be there. What to do? Right? So asymptomatic sonography detected stones. Most common. Right? And rest, as you rightly said, by the pain. So renal colic is a misnomer. There is no renal colic. The renal pain is a correct word, because when the stone is in the kidney, generally it does not give pain. Kidney stone is silent unless it comes into infundibulum, blocks, or it gets infected, right? Or because of the irregular surface. I will share the video later on, all of you can see various shapes of the stone which can give trouble. Right? When the stone is in the ureter, it blocks the passage of urine from that ureter. The peristalsis, we try to push that, it gives pain. Right? It's a colicky pain. Of course, what to do? If it is a small stone, it can be managed medically. Pain relief, first thing to do. Then, first investigation to do. What is the first investigation one can do? USG, available. So soon in India also it is going to be not only the radiologist alone. So we all have sonographies with us. The urologists, gynecologists, they do their sonographies. So you can put it, this thing you can watch also. So sonography is so common. Can sonography pick up all the stones? Especially ureteric stones? Cannot. Because of the window. How does sonography pick up something? What does it need? Basics? It has to have a waves going and reflecting back. So for a stone, it has to be a post-acoustic shadow, unless and until you have that. So sonography is the commonest. And then, what is the gold standard? It's not X-ray KUB, it's a non-contrast CT KUB, right? It picks up the stones. CT also tells us the density. You know what is the density of a stone? What is the density means? It's a Hounsfield unit. Everything has got units. What is the unit for sonography? What is unit for MRI? What is unit for CT? Yes? Sonography? Echogenicity. We talk about echogeny, right? Basics. So, unless we understand this, we will not be able to treat anybody, we will not be able to go for the prevention part also, right? CT is Hounsfield densities. MRI is, you read the reports, what is mentioned? What is mentioned? Okay, homework for you all. You can see that, right? So CT, plain CT will tell us, you can pick up even 1 to 2 mm crystals which are there. It tells us the density. The lower the density, the substance is likely to be uric acid, or some of the stones which are made of simple matrix of the body tissues, like indinavir stones, triamterene stones, retroviral which are given for HIV medications. Those stones have the same density as this. They cannot be picked up by CT. They can be picked up only by sonography. So it's simple to understand. We diagnose the stones by CT. Where necessary, we can do the functional study. Functional study means what? We give, what do we give? How do you know function of kidney? It has to excrete something. What is the study?
Kidney function test.
All of you know.
Kidney function test.
IVU?
Kidney function.
CT IVU. We give contrast and then see the contrast getting excreted to the kidneys. So we have diagnosed a stone, right? And then what is the treatment options available? First option. Sir, can I do something without any intervention inside? Medical management, medical expulsion therapy. For small erotic stones up to 5 mm, 6 mm with alpha blockers and good pain relief, good fluids, it can be given a try for a week, 2 weeks, 3 weeks. Provided renal parameters are normal, right? If it fails, then we go inside the ureter and we break the stone with the lasers. We got lots of advancements now, miniaturized instruments which can go and break the stones. There is a number. I don't want to go through all the slides, right? And then if it is in the kidney, what are the options we have? Can we go from below up to the kidney? Yes. Sir, can you do something as through the natural orifice? Yes. There are flexible scopes. A stone less than 2 centimeter, we can go inside the kidney and powder them with the laser. Right? We got wonderful laser machines. We can powder them there, and automatically it gets washed up. Right? Sir, can you do non-invasive? First you said something, medication. Now you are saying something through the natural orifice. Can you do in between? Is there anything? Anybody knows anything in between? Shockwave lithotripsy, ESWL, right? How did it come? In the 80s it has come. Common people talk about that as a laser. That is how the common people come and ask, sir, can you give me laser treatment? For them, it is a machine where a lithotripter, where you can share all the slides later on with all the students. So all the pictures are there in that. So when the patient is put on and a shock wave is given. You know how this has come up? German. One person observed the aircrafts used to land there, and that time there used to be a big rise in the pellets. It used to bombard onto the airplane, and the whole of this thing would be petted with the small holes. Then they said, can this be done onto the kidney? And then they created a first human machine that used to break the kidneys. Said, oh, that is how research always starts. Not only the stones that used to break the kidneys. Then later on, nowadays, good latest generation machines are available which focuses and powders the stone, which is called extracorporeal shockwave lithotripsy. One, sir, with the medications. Second, with the shockwave lithotripsy. Third, through the natural orifices. Can you do something? Big stone in the kidney, can you do something about it? Yes. Not open. We can make a keyhole into the kidney from behind. Percutaneous nephrolithotipsy called PCNL. Very simple procedure. That can be done where we break the stone and remove it. Right? We got jackhammer effects. It's like a drill machine, right? Or this machine gun. It just fires, isn't it? Like the bullets are there, it just oscillates and it hits the stone and it powders. Right? It's a lithoclast. Or we can use laser to powder that one also. Right? Now, both are not possible. Bigger. Can you do something? Yes. Lab assisted procedures are there. Last ones, open surgeries. If you ask me, open surgeries, yes. Still we do 1, 2, 3 in a year. For which ones? They need some correction in the anatomy of the kidney too. Where laparoscopy alone is not going to work out. Still open surgery has a place, but lot of advancements have happened in this. How to treat the stone, how to remove the stone. But what's happening with all this miniaturizations of the scopes, laser? So once we put a laser and powder the stone, what happens to that whole system? There is a dust storm, right? So these particles can go and stick. People have said less than 3 mm are insignificant residual stones, but they do form stones later. They form a nidus, they act as a nidus for future stones. Very, very important for us to understand. Although there is advancements, but still this risk is always there. Now, how to prevent? What is the way? Few tips. Once you treated, all done. But few tips, very, very important. Same thing for us to practice. What we don't have, we cannot give to anyone. Not possible. How can we do that? Most important thing is urine color. Common question asked is, how much water to drink? How much water to drink? It is to keep urine color like water. Very simple principle. Avoid all preservative food. All preservative foods. Stone disease is proven again in a high sodium content, animal protein. Avoid all of them. There are specific metabolic evaluation needed whenever necessary, but yearly health checkup with the sonography is very, very important. Right? Specific stones have got specific criteria. All of you will go through all that. But what I am talking to you is about a preventive aspect in the recurrence, our lifestyle and diet style. We don't want to be a part of this group of high risk. We do form, unfortunately, but can we work on that? Can we work on that? Simple discipline in our lives can make us reduce the risk of stones. Reduction in the risk of stones also causes reduction in, what did we see? Yes, very attentive, thank you. Risk of MI, right? We don't want to be categorized in the group of metabolic syndrome. This is the last thing that I'll ask. I'll stop and ask any questions are there. We don't want to be part of metabolic syndrome. Yes? What are the 5 components we discussed in that? So that we are not a part of it. Obesity, lipid profile derangements. That's a part of it, that's a mechanism. I'm just talking about what is done. Then third part, we don't want diabetes. Then hypertension and stones. We don't want to be having 2 of them. Rest 3 is guaranteed 100%. So we don't want. We need to work on that. If you work on that, we won't see the random plaques what we're talking about. Right? Advancement have not happened here, so we need to work there. Right? None of the books teach us this. None of the practitioners follow this because we all don't have time. We are busy in removing the stones. And the dietary part, prevention part, somebody else manages. Dietitian comes and speaks. The dietitian has not made any rapport with the patient. Patient will listen to us. Why? We made connection. Another simple understanding, if we are not falling into the group, when we go to the rounds, how many of us take time to take a chair and sit by the side of the patient and speak? That means you have time for the patient. You have time for the patient, you have time for yourself. Then we don't fall into the category of metabolic syndrome. Very simple tips. All of us can follow this. Thank you. Any questions? nobody has questions, I'll ask question. Not from this subject. So we are all students. We got exams. We study a lot. So morning I saw the topic, I couldn't attend. Work-life balance. Right? So this is the disease of imbalanced work-life. So what did you learn? Please share, I want to hear that. What did you learn in the work-life balance which can prevent the stones? Now you answer. I want to take some learnings from you also. Not learned anything today? There was a topic, work-life balance, which can prevent stones. We should know the names, otherwise we could easily ask people. Lifestyle. Who said that? Okay. So what is the lifestyle we want to adapt? It will inspire others. Very important. Very important. What is the lifestyle we want to adopt? What is healthy life? How to maintain the healthy life in our work profession? How is it possible? In Western world, people don't study like this. We have got our reference books, no? They don't. All our reference books are our textbooks. In Western world, you go and see they are not their textbooks. So much studies. We continue to take n number of teas. I used to take 20 teas. Canteen used to be down there. I used to just come outside and give a awards. The fellow will come chai. Right? 24 hours, 20 teas. Right? Very high risk of calcium oxalate stones. Oxalate rich. You can read the labels. Right? I'm just talking, give an example. If we reflect in our own lives. Anybody else wants to say anything? Healthy lifestyle. We can minimize the teas, if not completely stop. We can look at the label and see non-oxalate teas. Yes, possible? Yes or no? Yes. What else? Water. Very important. One positive thing was there. I was just waiting, somebody will say that. It's enough. Enough. How much water to drink? How much I need water to drink? Somebody is saying 5 liters, somebody said 5 liters. 2.5 somebody is saying.
Urine color should be like water.
Yes. Somebody in the Rajasthan, if you say 2.5 liters, not going to work out. Huh? Somebody is in the air condition, right? And you take 2.5 liters, sir? 2.5 liters. How many times I have to go? That person will say. Right? So, madam rightly said, what is the important thing? Urine color. It should be like water. Very simple. So, that's why I said, how many of us look at color of urine? Very important. Right? So, if there are no questions, my request to all of you that please, if anybody of you go to the research or medical sciences towards research or even urology, please look at the aspect of prevention of stones. Please work on this. Give time to your patients. Sit down. Once you sit down, you have time. Patients are there 24 hours. You are helping yourself by sitting down. Don't think we are helping the patient by favoring them by sitting by the bedside. No, we are helping ourselves. We sit down, we help ourselves. That we settle down, we can talk to the patient. He talked about, Dr. Lahani talked about EQ. What is EQ? What is talking about EQ? Emotional connect. If it is not there, very important, very common things we see now. The patient gets admitted, 5 different specialists sees and goes. Patient asks, sir, तो हो गया, सब तो देख लिया, लेकिन what is wrong with me? What is wrong with me? Is anyone who is going to tell me that these are the things you need to do? Who is spending time? The primary consultant has to sit with the patient and explain. Then we don't form stones, not them. Right? Thank you very much. And from Bhaktivedanta Hospital, greetings and